Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient and Family Learning Center at Mass General. Today's program is part of our MGFC Family Centered Care Series, a special collaboration between the Blum Center and Mass General for Children. Before I get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has mute so we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I would like to introduce you all today's guest speaker. Joining us today, we have Dr. Annah Abrams. Dr. Abrams is a child, adolescent, and adult psychiatrist. She is also the director of the Adolescent and Young Adult Cancer Program, chief of the Division of Pediatric Psycho-Oncology, and an attending physician on the Child Psychiatry Consultation Service at Mass General. Her work focuses on the emotional health and well-being of children, adolescents, and young adults with cancer. In recognition of Childhood Cancer Awareness Month, she joins us today to give a talk on optimizing care, outcomes, and experiences for adolescents and young adults with cancer. So please join me in welcoming Dr. Abrams.
Thanks so much, Amy. I'm going to share my screen and pull up my slides. So thank you, Amy, for inviting me and our team to present today on adolescent and young adult cancer. I'm going to be talking today about this patient population, as well as talking about our own experiences here at Mass General Hospital and the program that we recently developed. I do not have any financial disclosures to share. So first thing, and I think helpful for us to get started, is what is AYA oncology? AYA stands for Adolescent Young Adult. And this is defined nationally as individuals between the ages of 15 and 39 who are diagnosed with cancer. It's a broad age range, and I'll talk more about that as this talk progresses. And what's notable is that it actually accounts for a very small percentage of patients diagnosed each year in the United States with cancer, less than 5%. But that 5% represents almost 100,000 adolescents and young adults diagnosed with cancer each year. And for context, I thought it would be helpful to share with you, just so you have a sense of where these patients fall in terms of their ages and their diagnoses. And so this is a pretty busy slide, but what you can see is that in the younger, so our adolescent patients, from 15 to 19, the distribution of the kinds of cancers we see fall into sort of larger categories of thyroid. We see a lot of lymphomas, Hodgkin lymphoma, brain tumors, leukemias, as well as sarcomas, which are bone cancers. As we progress into a slightly older age group of people, the 20 to 29-year-olds, you can see that the percentages change a bit, and you can see a pink slice there with a little bit of breast cancer, not percentage-wise as much lymphoma, and more than testicular cancers that we see in this age range. And then as we move into the 30s, you can see that the color scheme changes a bit more. There's more representation of breast cancer, smaller representation of brain tumors. Adolescent and young adult cancer rates are increasing. And this slide and the next slide are shared by my colleague Vinayak Venkantaram. And it shows that the cancer incidence is increasing in this patient population, more so in females than in males. And we see here this 5-year incidence rate of the types of cancers that we're seeing in this patient population. And as I showed you on the last slide, it really does depend on what age group we're talking about. So you saw that breast cancer we're not seeing in the very young, but we're seeing in patients who are in their 30s and an increasing rate. Testicular cancers we're seeing in patients in their 20s, the lymphomas and brain tumors, bone cancers in teenagers and those in their 20s. And what's quite noticeable is that there is a very high, what we call event-free survival, 5-year survival rates for our AYAs with cancer, 85%. But it really does vary amongst the types of cancers that our patients are diagnosed with. And our patients with Hodgkin's lymphoma, that's the HL, and testicular cancers have excellent responses to treatment. And we are not doing as well with our patients with sarcoma, bone cancers, or brain tumors. So why is it important for us to be thinking specifically about adolescent and young adults with cancer separately from our pediatric cancer patients and our adult cancer patients? And I think that this study, which is called the HOPE study, Health Outcomes and Patient Experiences, which was published back in 2019, really sets the stage for why this is so important. So this study was a multi-center study, and it looked at more than 500 patients who were treated with the types of cancers that are listed here. And they noted not only was there a low awareness of clinical trials for these patients, but that cancer at this time in one's life had a substantial impact on people's physical and mental health, their relationships, and family planning, financial burden, and their education and work. And why is that? Well, cancer diagnoses and treatments occurring during this time, it's an incredibly pivotal time in people's development. Teenagers are just newly independent. Young adults are in college and or setting out on their own. It's a changing time between pediatrics and our adult worlds. Not only that, but the treatments we use because of the, the types of cancers, many of them have greater toxicities because of the age of the patients. For example, toxicities on one's fertility and sexual health. Patients are treated differently depending on the location. So they're inconsistent treatments. So some people may be treated at pediatric cancer centers, some patients may be treated in adult cancer centers, and some in between. There's generally been a low clinical trial participation rate. Many patients in this age group are underinsured, and this patient group also has lower adherence to treatment. One of my favorite books that really describes best what's happening in this patient population is a book called Between Two Kingdoms, written by Suleika Jawad. And she's a brilliant young woman who graduated from Princeton University and was spending her first year after college working in Paris, at which time she was diagnosed with AML, acute myeloid leukemia. And she returned to the New York area for her treatment. During the course of her treatment, she wrote a column for the New York Times called Life Interrupted. And this book is actually divided into two sections, and her Between Two Kingdoms are actually the kingdom of the well, the kingdom of the sick, and then goes into the kingdom of the well. It also is between two kingdoms in terms of the kingdom of pediatrics and adult, one could say. There are many quotes from this book that I think we could look at and refer to that are emblematic of what our adolescent young adult patients experience. I think these two really reflect how this patient population is caught in between. Her boyfriend crowned her the oncology tween queen, a year too old for pediatrics, but decades younger than most of the other patients in an adult oncology. And then this quote, "My quest in the last few months has been to become an adult, but standing there among the brightly painted walls and jars of lollipops, I wished badly I could be in pediatrics, where I was closer in age to many of the patients, rather than downstairs in the bone marrow transplant clinic with the early bird crowd. And I have to say, I smiled when I read this. Here in our pediatric clinic, we actually have a lollipop tree, and we have many brightly painted rooms, the Red Sox, the Patriots, as well as Disney characters and others. And down the hall, upstairs and downstairs, one flight is beautiful oncology spaces, but very differently decorated. So many people in the United States have really started thinking about how do we address and consider the needs of the AYA patient population. And in 2023, the National Comprehensive Cancer Network pointed out the very specific things that we should be thinking about, that there are unique medical and psychosocial concerns. Fertility and sexual health has to be addressed. There's psychosocial considerations, education, employment attainment, and retention. And not only that, they went a step further to say that AYA patients, if feasible, should be treated at cancer centers that have specific AYA programs to accommodate the needs of this patient group. And so it's in this light that we here have been very fortunate to develop an AYA cancer program that really is looking at and targeting how do we optimize the care, the outcomes, and the experiences of our AYA patients with cancer, and how do we provide an integrated care for them, do research, and provide education. So I show this here as just an emblem of what it is that we're thinking about and how our AYA program has been developed to meet these needs. So first, I'd like to talk about fertility. Fertility, now this is already 15 years ago. ASCO, which is the American Society of Clinical Oncology, came out with guidelines to say that oncologists should discuss fertility issues with reproductive age cancer patients and offer referral for preservation consultation. After these guidelines were posted, according to the HOPE study, the rates of these discussions went up significantly. And now 70% of AY cancer patients were told that their treatment might affect their fertility. But starkly, 2 times as many males as females, fertility options were discussed. And many more males, they were arranging for fertility preservation. Now, a large reason for this is that it is easier to do fertility preservations in males than females. And it's easier to talk about sperm banking, and it can be done quickly. The thing that we have heard from patients and what we read about in the literature is that people don't talk about it. So some patients will say, no one on my medical team talked about it, nor shared with me that my treatment might affect my fertility or cause early menopause. I wish that my desire to have children had been an automatic part of the conversation, and that the impact of infertility has ripple effects, and that there is life after cancer, and I wish we had talked about it. Another area that is often avoided or not talked about at all is sexual health. And I think that this quote really speaks to that, which is that my physician seemed so uncomfortable talking about sex, it made me uncomfortable. The onus should not be on the patient to bring up sensitive or difficult to talk about subjects. And in recent papers, they've talked about the impact of treatment on one's sex drive, sexual health, and a desire to have sexual health consultation, and a discussion about sexuality. And in this same light, many patients will say, if you ask them, that nobody brought this up in their discussions, that it would have been helpful if someone had said to them, this is something to think about, or we could refer you to a sexual health consultant, that they felt incredibly alone because they didn't realize that they were the only ones who were experiencing a decrease in libido and energy, and that they wanted to be able to have a full life, and they wanted to know how to do that. This slide here is a graphic about mental illness among adults that is actually not cancer patients. And the reason that I show this here, and this is from a government website for Substance Abuse and Mental Health Services Administration, is to show you the high rates of mental illness in our adolescents and young adults. As you see here, it shows that the past year prevalence was 30% in 18 to 25-year-olds, 25% in 26 to 49-year-olds. Why do I highlight a general graph here? Because in our AYA patient population and in our cancer survivor data, there are actually even higher rates than the general population of depression, anxiety, trauma, and stress-related disorders. So something that we need to be more aware of. And what we hear from patients is that a few things. There's patients who've said to me that their providers have said, oh, of course you're depressed, you have cancer. And they appreciated it being acknowledged, but then they're like, well, but isn't there something I can do about it? Other patients have shared that they wish that they had been referred to mental health services or offered the option of having mental health services, that they had providers who were aware of the impact of cancer on their overall mental health and emotional well-being and could sit with people who have serious illness. And that sense of wanting help and not knowing how to ask for it. Financial stress is also something that is really quite impactful for this patient population. And in the HOPE study, they found that 65% of patients reported that their cancer treatment had a negative impact on their financial situation. Financial advice actually was the most common supportive service as an unmet need. And interestingly, most were insured during this period, but up to 25% had periods without insurance post-treatment. One thing I hear from our young adult patients is they feel, protected when they're in their early 20s because they can remain on their parents' insurance. But what happens when they turn 26? Others have said that they feel newly dependent on their parents and family for financial support, and it's hard to dig out afterwards. And then survivorship. Who am I now and what now? So much of oncology treatment is focused on treating the cancer and getting people through it. But what we often don't think about is what happens after the bell rings. For some of our patients, they say that that's actually the hardest time. The inner scaffolding that they had, the team of people who were involved in their lives on a day-to-day basis, crumbled and was no longer present. And what life are they returning to? If you're a college student and you took time off to get treatment and you go back to school, are your friends still going to be there? Is your perspective on your college, your career choice that you were going to make the same as it had been before, or has that changed? Will your job take you back? Will they take you back in a part-time capacity because you don't yet have the energy and the stamina to work full-time? We expect people to resume their lives, but we don't necessarily give them the tools on how to do that and to reintegrate. So it's with all of this in mind that we created the Adolescent and Young Adult Cancer Program here at Mass General. And we were very fortunate through philanthropic funds to have actually instigated by a patient and a patient's friends and their family that they wanted more support, and it was important to them to have more support during the course of their treatment. So it was just only a year ago that we formally introduced the Adolescent and Young Adult Cancer Program here at Mass General. And it's really, how do we address the concerns that have been outlined so far? How do we think about fertility, sexual health, mental health, financial survivorship, and so forth with this patient population? So I first want to introduce you to a patient who was treated here. I'm going to play a very short video, but I think her experience is, one experience of a college student going through treatment. In this short video, you'll also see me speaking about what my hopes are for a program, as well as Dr. Giselle Perez, who's the Associate Director of the AYA Cancer Program.
It was really hard being in college diagnosed with cancer. Of course, once I started treatment, I lost my hair, and so I was just starting to meet everybody. I was just starting to really get into the groove of college, enjoying myself.
I've been really struck by how challenging it has been for our older adolescent, young adult patients to navigate their worlds, not just the cancer world, but their worlds, their college life, their independence, their social activities and engagement, their interactions with their family. And I've been really intrigued about and wondering, how can we serve this patient population better?
I would go back and forth every other week for treatment. I was treated on Fridays. My dad would pick me up on Thursday nights, and we would go get dinner, and then Friday drive to Boston for treatment, and then I would spend about a week at home, and then I would go back to school. So I didn't really get the chance to make a lot of friends. And just being on a college campus sick, I really felt isolated a lot of the time. It was definitely really difficult connecting with people and being a normal college student.
Looking at it from a developmental standpoint, think about all the things that are happening as an adolescent young adult during this age frame. You're in high school, graduating from college, developing a career. It's this aspect of becoming independent. You're thinking about your sexuality, your sexual health, having a family, developing your professional identity, and then you're getting hit with this cancer, which can mean so many different things depending on your diagnosis and treatments.
I think it's really important for people who are my age with cancer to have other people to connect with. I know once I had cancer, Dr. Abrams was able to connect me with a lot of other people who were my age and had cancer. And to have somebody in that age group who gets it and can understand the things that nobody else could really ever understand unless they were also going through it was really important. And that really helped me get through everything.
I'm just going to click out of this video. Let's see. Sorry. And actually just bring back up the website. So, everybody's experience as an adolescent and a young adult is different. But I think that this is one patient experience which is helpful in our understanding of what patients' experiences are and what they need, and how isolating of an experience having cancer can be as an adolescent and a young adult. So what is it that we've created here, and what is it that we're thinking about, and how are we doing that? So as we talked about before, the areas that are notable for most significantly challenging and areas of unmet need for adolescents and young adults are in areas of fertility and sexual health, for example, overall social support and connection, emotional health and well-being, and financial well-being. So what we have done is we created an AYA cancer patient needs assessment. Now, as I mentioned, our program formally started only a year ago. And what we decided was to start out looking at and working with patients in pediatric oncology, in sarcoma, because these are areas that had large patient populations and percentages of patients who were in this group. And then since then, we have started to add on neuro-oncology, which is patients with brain tumors. As you noted in the slides that I showed earlier, there's now increasing patients in breast cancer and in lymphoma and leukemia and in other areas in our cancer center. And our hope is actually to expand into those areas and to do these needs assessments in those areas as well. So currently, we have an AYA program manager who meets with patients who are in treatment and provides them with this needs assessment. And the idea here is to find out that since a patient was diagnosed with cancer, which of the following services are they interested in using, or are they just interested in learning more about as they go forward in their treatment? And we ask a range of questions here. And these are all questions that are areas of need that have been identified in this patient population. So we ask about counseling services and support groups. We ask about whether or not patients are interested in meeting with another peer who's going through cancer for our peer mentoring program. Whether they have questions about the impact of their treatment on having children, and or any interest in talking about or learning more about sexual health and functioning. How about intimacy and relationships and being able to talk about that with somebody? Are they parents with young children, and would they like more support in how to talk with their children about their illness and or their children's adjustment to their treatment? What types of integrative therapies are they interested in receiving? Would they benefit and or be interested in stress management and coping? More information and or referrals to nutrition, lifestyle medicine, religious support. How about outside resources like camps and retreats? And then medical marijuana, which is something that has been asked about a great deal, health insurance, financial resources, and so forth. And after we have the patients meet with the program manager and complete these needs assessments, we then take this information and, serving as a hub, we refer patients out to the various specialists and specialties that we have here at Mass General Hospital. And this is actually a place where we've been very fortunate. So one of the things that we have found is there's an array of services that people are interested in and want more information about. So far, we've met with 100 patients over the past year, and the services that have been checked off the most have been social work services, nutrition, medical marijuana, information about fertility services, and massage and acupuncture, which is part of our integrative therapies. So what does this mean in real time? So if somebody is interested in connecting with social work, then the AYA team reaches out to the social worker from the specific clinic and makes sure that the social worker is aware of this patient and connects them. Medical marijuana has become a much bigger field over these past recent years. It's now legalized in Massachusetts for recreational use, but how do we give people information that's going to be helpful to them specifically when they're going through treatment? And so we have paired with ECS Wellness, which is run by a physician who's part of the Mass General Brigham group, to help patients navigate and learn more about how they can use medical marijuana during their treatment. And in terms of information for fertility services, we are connected with the reproductive endocrinology service so that we can refer patients in to have those concerns met. And this is actually, so when our program manager meets with a patient, they receive this bookmark, which we created. And the idea behind this is to sort of pique people's interest and also let them know that these are services and questions that they might have. So one thing you can imagine is someone is going through treatment for cancer and they fill out a needs assessment. And when they fill it out, they are overwhelmed with lots of other things, and they actually don't really have any questions at the time that they fill it out. And later on, whether it's a week later or a month later, they think to themselves, well, actually, they might be interested in learning more about the peer mentoring program or are curious about mind-body medicine. And it's not that they only that one point in time can avail themselves of the services, but rather that they can reach out and get in touch with our team at any point in time. The other thing that's been developed over time, and it's actually been in response to patients' interest and needs, are support groups. And one that started this year that has been running monthly is the AYA Sarcoma Support Group, which is run by Jackie Cardarelli, a social worker in sarcoma, and Christina Kim, the nurse practitioner in sarcoma. And they've been meeting once a month. There's also an AYA brain tumor support group run by Sandy McLaughlin, also a social worker. And one of the things that the teams of folks who've been running these support groups have noted is that it is really different than the general support groups in the Cancer Center, that it is really nice for the patients who are participating in the program to look around and see people who are in the same age group as them. And as Suleika Jawad said in her book, it wasn't that she was, looking at people who looked like her parents and her grandparents, but rather as her peers. Another thing that has been targeted to our AYA patient population is the Mind-Body program for cancer survivors, which is run by Dr. Giselle Perez, who is also the associate director of this program. And in the spring, they were running mind-body programs for cancer survivors for all ages. They started having one specifically for AYA patients. Again, recognizing and realizing that there's something different about going through this experience as an adolescent and a young adult than an older adult. And they will be running another session starting this fall that'll just be specifically for AYA patients. We also are hearing from patients that they want to learn more. They want to know more. They want to know what's out there. They want to have access to things and learn more about them. And we've had some educational workshops and have linked the talks to our website, including a fertility talk with our own Dr. Mary Morris, who's in reproductive endocrinology, and a medical marijuana talk by Dr. Ryan Zachlin, who I mentioned before from ECS Wellness, as well as collaborating with outside organizations for our own AYA care providers. There's a Northeast regional network as well as national groups. And doing research. As I mentioned at the beginning, there's a low involvement of AYA patients in clinical research. And our own Dr. Giselle Perez, who runs our research program, has been focusing on cancer survivors and the Mind-Body program, with more research to come. How about the social engagement and connection? So one thing we hear a great deal about from patients is that sense or feeling of being alone, that there's no one else in the waiting room who looks like them, that they feel disconnected and not a part of their peer group anymore, even if their friends stick by their side, even if they're still talking with them. And how do we connect people? We have a MGH peer mentoring program, and that's a one-on-one program that was developed, which pairs patients who've been through treatment with patients who are going through treatment. We also have some local and regional and national organizations who have connected with us to provide services. And one of the nice things about this is that these programs have services that connect patients in all different kinds of ways. So for example, Elephants in Tea is a wonderful organization that has online journal writing and virtual meetups. They also publish a monthly magazine, which we give out to our AYA patients. It's been a wonderful respite kind of place when people go to some of their gatherings. First Descent is a completely different type of group. First Ascents is an outdoor adventure experience. Most of our patients who participate in that have completed treatment. On our website, there's actually a wonderful video of Lauren, who's a nurse here at Mass General Hospital, who was treated for cancer and has now become very involved in the First Ascents program. And there's a video about her own experience with First Ascents. Next Step is a local organization that has collaborated and worked with us over the years and has what they call campference. So unlike our medical conferences, a campference for adolescent and young adult patients who are going through or gone through treatment, where they meet together for a 3-4 day experience to talk about and share and enjoy each other's company and camaraderie and bonding. And then we've also collaborated with national organizations that have resources that can support our patients and also all of our care providers in providing the special care that we need and we want to provide to our adolescent and young adult patients. None of this work could be done without an incredible team of people. And I've had the privilege to be able to work with providers in pediatric oncology, adult oncology, across different disciplines. And I want to highlight the team in sarcoma and in pediatrics and the orthopedic oncology teams and all of the people listed here on this slide, because it really has been an incredible effort and team effort across disciplines to ensure that we can be a hub for our AYA patients, and we can connect them with the services that they need and want here at Mass General. Thank you very much for listening to this webinar today, and I'd be happy to answer any questions or have discussions.
Thank you so much, Dr. Abrams. We are now at the end of the session, so if you have any questions for Dr. Abrams, feel free to enter them in the chat. We have a question regarding how families and your friends can support AYAs with cancer.
It's a wonderful question, and one that I think we think about a lot. One of the things I didn't mention was sort of what are some of the differences between how we approach pediatric patients versus adult patients. And in pediatrics, it's a very family-centered care of a patient. It's a holistic kind of approach, or that's how we'd like to think about it in the pediatric world. And in the adult world, the treatment is much more individualized and disease specific. And so one of the things that we're sort of thinking about is how do we use the things that we've learned in pediatrics in our family-centered approach to care? How do we lend that self to this AYA patient population? How do we do that in a way that's collaborative, that our AYA patients still have autonomy and independence in their meeting with their care providers, but also recognizing how much parents are still involved in someone's life and their family members as well, siblings, aunts and uncles, and their friends. And how do we pull them more into being able to support them? So sometimes that's in collaborating with social workers. Sometimes it's asking and really providers saying, are there other people you would like to be here with you? And sometimes it's in these social engagement opportunities where what we say is, that someone brings a wingman with them, that you go with a friend or someone else who supports you, because we want them to also know about your experience so they can feel apprised of it and they can join you in that.
Thank you. And how about healthcare providers? How can they support AYAs with cancer who may not be part of your program?
So one of the things that we are hoping to do as this program expands is to not only provide educational opportunities for our patients, but also provide those opportunities to other care providers across the cancer center. And one way in which we're hoping to do this is to have what I call AYA champions. And that is nurses, nurse practitioners, physicians, and social workers and care providers throughout the cancer center who are going to be aware of the specific kinds of needs and questions that AYA patients might have, that AYA patients might not ask or be afraid to ask or not be sure of, and positioning them throughout the cancer center so that we can expand our footprint in a way that's going to be helpful to those patients, as well as educating our peers and our colleagues about what some of these issues are, so that we can provide a more holistic approach to their care.
Thank you. Are any of your programs or services available through virtual visits?
Yes. So actually, many are. So for example, one of the things that we've done for the needs assessment is that some patients have found they really enjoy and like meeting with the program manager face to face. They're bored, they're sitting here getting chemotherapy for the day. It's kind of nice to have an interruption, sit down with somebody and fill out the needs assessment on the iPad. And there are others who say, you know what, when I'm here, I'm just here getting my treatment, or it's not going to work out. Can we meet up by Zoom? So we've done both in person and Zoom for our needs assessments. And actually, many of the programs now are virtual. The sarcoma support group is a virtual support group. The Mind-Body Cancer Survivorship program is virtual. And the peer mentoring program is by phone and text, is not an in-person. You know, I think that COVID changed a lot for many of us. I don't think I ever would have anticipated that we would have virtual groups and meetups. And I think for our AYA patient population, it's been a real bonus because people aren't always in the same place at the same time. And so it's allowed us to expand the offerings. Again, like with Elephants and Tea and some of our outside partners, it's also allowed our patients to be able to avail themselves of services that aren't based right here at Mass General, which has been really, really nice. And then I will say, as somebody who loves meeting with people and seeing people, it's also been really nice to have the option of being with people in person and connecting in real time. This past weekend, the MGH had their cancer run, and we had an AYA cancer team. And it was incredibly nice for people who had met over Zoom, whether it was in support groups or seeing each other or passing in the clinic, to actually meet up in person. And that was really nice.
Great that you have all these support groups available. For the internal ones that are run by Mass General, do you have to be part of the AYA program to participate in the support groups?
I'm sorry, say that again. I missed the question.
The support groups that are offered internally, do you have to be part of the AYA program in order to participate in them?
No, so there's no sort of membership, so to speak, in the AYA program. The AYA program is really that any patient can avail themselves of these services and can reach out to us. We really started in a small way. We're a small group of very dedicated clinicians who are volunteering their time. And so we started out in pediatrics and sarcoma because that's where we've had people and that's where we've engaged the most with people. But patients can reach out to our AYA program manager to ask about the various support groups. There are criteria for participating. For example, in the sarcoma support group, it is geared to patients who are on treatment in a particular age range, or I think maybe just having completed treatment, as opposed to maybe for people who are, you know, a few years out, they wouldn't fit into that group. So the criteria for participating are different for each group, but not whether they're sort of a member of this group. Yeah.
And for those who are learning about the AYA program by joining this session, how can one participate? You know, like, is there a number or an email they can reach out to?
Yeah. So we have an email address, which is ayacancer@mgh.harvard.edu. If I said it too quickly or you don't remember it, if you just go to the MGH AYA Cancer website, there's actually information there. There's our email is there, and there's a link as well.
And once they're part of the program, can they actually age out of it?
That's a great question, and I think we haven't even faced that yet since we are so new. I think the idea here is we want to meet people where they're at. We want to be able to provide services to patients who need them, and we're figuring some of this out as we go along.
Thank you. We have a question regarding tips for families. Do you have any suggestions on how families can start conversations with their children who may not always want to talk or share the feelings as they navigate through life and their cancer diagnosis?
So are you saying that this is in terms of, so there are two different kinds of questions, I think maybe, and one is parents who are young parents who have cancer themselves and they're going through treatment and they're wondering about how to talk about it with their own children. So there's actually a wonderful program here at Mass General that we're connected to. It's called Parenting at Challenging Times. And that is a group of clinicians who meet with patients who are going through treatment and their spouses, and they talk with them about developmentally where their children are at. You know, do they have 3 and 5-year-olds, or do they have 10 and 12-year-olds, or somewhere in between or older? How do they talk with them about their cancer diagnosis, their experience? They are linked on our website. They also have their own website, and they are a free resource to any patients who are going through treatment here at the Cancer Center.
Thank you. What are some ways in which families can take care of themselves while also caring for their children with cancer?
I think we often don't recognize and realize how hard it can be to take care of others who are going through treatment. And so we don't necessarily give ourselves the grace to say that we need support or we need help, because we're observing those going through treatment and recognizing and realizing how hard and challenging it is for them. And this is something that we're sort of working on. In the pediatrics world, we have a social worker who specifically works with parents. And so if it's an 18, 19, or 20-year-old who's being treated in the pediatric center, the social worker will meet with their parents. However, in the adult world, the treatment is more focused on the patients themselves and less so on the care providers. There are some groups through the Cancer Center that are now providing support for, spouses of people who are going through treatment, but much less so parents of young adults going through treatment. And I think it's something for us to think about. And, as we develop this program, think about what areas are there that we could be providing more support, and thinking about how to support not only our patients better, but their families.
Thank you. While we wait to see if there are any further questions in the chat, do you have any final thoughts you'd like to share with the audience?
I think the thing that I want to share with everybody is that we don't have all the answers or all of it figured out. We do know and recognize that our adolescent and young adult cancer patients are a vulnerable group of patients, and that their needs are specific, and that we want to recognize that, and we want to make sure that we're open to hearing, listening, and learning from our patients and their families. And what are the things that we can do to ensure that our patients are getting the best care possible in an integrated way here? And I think we are quite fortunate being in an institution that has both pediatrics and adult cancer care that is fully integrated, so that my office here is in the Pediatric Cancer Center. Down the hall is the General Infusion Unit. Downstairs, one flight is adult sarcoma, and upstairs is the lymphoma team. And that we're all working together to think about what are the best ways that we can provide care to this patient population.
Thank you so much. And thank you so much for all the work that you and your care team does.
Thank you.
And that's for everyone joining us today. Thank you so much for joining us. As I had mentioned, today's program is being recorded. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.
Thank you.